For this procedure, you will need some 20 ml syringes, green and blue needles, local anaesthetic, bone marrow needle, sterile pack, specimen bottles, slides, sterile dressing, and some alcohol skin prep. Position your patient in the fetal position with the flat back parallel to the side of the couch. This patient has had previous biopsies, which makes it easier to see where to take the biopsy from. Feel round the iliac crest to the posterior superior iliac spine. As the procedure is not straightforward, it is always better to prepare as many slides as possible, with a minimum of 6 up to about a dozen. Lay these out before starting the procedure. Clean the area carefully with the ChloraPrep. Administer the local anaesthetic first superficially and then deeper into the soft tissues. Thorough infiltration is important as the periosteum is extremely sensitive. The bone marrow needle contains a guard which can be removed when taking a sample from the iliac crest. However, when performing a sternal sample, this is very important as we are not after a biopsy of the aorta. The guard simply stops the needle from entering too far. When you are ready to take a sample, the introducer is removed from the needle. A syringe then collects the sample. Applying enough pressure, advance the needle through the soft tissues. Once you reach the cortex, apply firm pressure to pass through it. At this point, you will feel it get softer. You will find that you will need steady, sustained pressure. Gently remove the introducer and aspirate the sample. Remove the needle. To prepare the slides, first drop some of the sample on each slide. To spread the sample, take another slide, draw back along the sample, and then spread and lift. If it starts to clot, you can do a squash by just resting the slide on top and then spreading and lifting. You are aiming to produce a monolayer of cells. When taking a biopsy, we are using the sharp cutting end of the needle to remove a core of tissue. The tricky part is hoping that the core of tissue will stay within the needle whilst withdrawing it. Again, using steady pressure, advance through the cortex. Remove the introducer. Using your finger as a guide, you can estimate how much sample you are going to remove. When you think you have enough sample, turn the needle. This will help ensure that the core of bone marrow remains within the needle. Give a slight twist at the end. Then remove the needle. Place the guard on the end and push the biopsy out. Roll the sample along a slide. This slide can then be stained and some information can be obtained more quickly. Place a pressure dressing on the biopsy site. Label the samples, including patient details and when the sample was obtained. The slides can then be placed in a protective storage case. With any procedure, it is important to document it carefully in the notes.